are from the Center for Family Health. We have Support Services Manager Nate Nimps and Clinic Supervisor Christina Henderson. Hey guys.
Hello.
Welcome back. Good to see you both.
Yes,
Yeah,
good
you
to
too.
see you.
So I think a week or so ago we had the new CEO.
Yes.
Has he started
Yes.
yet?
Yeah, he has. Yeah, he's getting acclimated, of course, meeting all of our staff, and yeah, we're very excited.
Yeah, that's Bill Lipinski.
Yes.
Yes, all the way from Iowa.
Yes.
Yes.
Yeah.
So we'll get to know Bill more as months go on. But first up, as summer is underway, we want to talk about summer at the Center for Family Health. What is summer like at CFH, Nate?
So we lots of sports physicals,
Uh,
of course, right? Gearing up for the school year. And we do have our school-based health centers, all 4 of which are open. Christina, I'll let you talk about that a little bit.
Sure.
yeah, what are they? Does everyone know where they are?
Well, if you don't, they are located at Parkside Middle School. We have one at Jackson High School. We have one at Northeast Elementary and Northwest Middle School. And there we do everything that you would get at our main site downtown.
Misconception about school-based health centers is that they're just for school.
Yeah,
No.
Right.
not at all. Nope, we're open to the community just as we are at our downtown location. We see all ages, from infant to older adults.
And school ended on Friday. Do the centers close for the summer?
No, they do not.
No, we're open year round. Yeah.
It's actually it's busy year round.
Mm-hmm.
You don't have to be in the school community. You don't have to live in the school
Right.
district.
Absolutely. Yeah.
All right. So school physicals. So I know that students that are going to be in athletics, for example,
Mm-hmm.
they do have to get some sort of physical
Yeah.
done before.
Yep, yeah, sports physical we call that. But we do recommend, it is recommended that all children receive, an annual physical. And summer's a good time to do it. So we really we want to do those in June and July, right, before August. Because usually August, we get that rush of people back to school. And we do have a promotion that we're offering this year. I believe 10 kids age, do you know the age? For the kiddos?
10 to 18.
There it is. Yes, 10 to 18.
Yeah.
We are doing a promotion. We are offering a $100 gift card. So anyone who is received a sports physical will be entered into that drawing. So
Awesome. And you're doing that every month?
every month, 5. Yeah, we're going to do for
Well,
the month of June and July.
Yeah, June and July.
So
Yep.
10
We're
kids
trying
total.
to get students or kids in prior to August, before the start of school. So.
And kids that are starting school for the very first time, either pre or K, or they have to, I think there's certain requirements, certain immunizations that they have to have before they can go to school.
Yep, it's called a health appraisal. Most schools require those, and/or daycare centers. And when you come in for those types of physicals at any of our locations, they make sure the child is up to date on immunizations. We do other important screenings, including vision and hearing, and for the older kids, depression screening and stuff like that as well.
Should you wait until the day before school to do that?
No, we highly recommend you don't. And that's why we're wanting to promote our locations in case you aren't able to get in to see a primary physician at our downtown facility. We do have those other facilities available, and we welcome everybody. You do not have to be a patient at the Center for Family Health, of course, to use those.
And I also want to mention too, there's often not an out-of-pocket cost when you come to the center for things like physicals. If you, for example, if you have Medicaid, that usually covers that. Even most other insurance as well don't require a copay for physicals. And then of course we do have our sliding fee discount program as well, if there is any cost and assistance is needed. So.
Yeah, so people are probably unsure, who the center is for, and it's for anyone.
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 Yes.
Yep.
So let's go through the process. You've never been to the Center for Family Health. You want to set up a physical or some other service. You want to be seen. do you call, is there like one number you call, or does each location have their own number?
So you can actually call our main office at 517-748-5500, and you'll speak to one of our schedulers, and they can do all that right there in the central scheduling office. So.
Do the different locations, do they specialize in certain things, or pretty much they all offer the same services?
Same services. Anything as far as immunizations, screenings, any tests that can be ordered, we do that at every location. We offer blood draws at each of the locations as well. I know the convenience of that is also at our downtown facility, but we also are able to do that at our off-sites as well.
And then I do want to mention as well, we not only do we have the medical services, but currently 3 of our schools, so Northwest, Jackson High, and Parkside also all have a therapist on site as well.
Mental health therapists?
Yes, yeah. Behavioral health, we call them behavioral health consultants, but yes, they are licensed clinical therapists. So.
And I think we as a community and a society have become more aware that everybody can benefit from mental health services.
Absolutely, yes. And our therapists are working there throughout the summer. They're going to be there about 4 days a week, and then one day they're going to come to the main office to help us out. But they are available to see patients.
So I was talking to my sister in North Carolina yesterday, and she has, I can't believe this, but she says she has a $14,000 deductible for the year. So she's trying to find things to have done to
meet her
Right.
deductible.
So
Goodness.
Yeah, so she's had cataract surgery on her eyes.
Okay.
She's have a number of things, but I mean, holy mackerel, 14,000.
That's a lot.
Yeah.
Yeah.
So I'm guessing that so she's got high deductible, so her premium's probably lower.
Right.
Yeah, that's true.
So people that have deductibles,
Yeah.
there's co-pays. You have, like people that can navigate all of the insurance issues.
Yeah, of course. Yeah, so we have our financial service department, and then of course we have our community health workers as well, and they can help with navigate all those issues, help you kind of figure that out and see is there something maybe we're missing that you might qualify for, and that's done at our main office. Probably start with our financial service advocates.
So I'm sure there are people without Medicaid or without any insurance whatsoever. They've got no help from medical. You can work with people.
Absolutely, yeah, that's what we're here for.
Yeah,
Nice.
we will see anybody despite their ability to pay or not.
How about the vaccinations? There are recommendations for a new round of the COVID vaccine. You guys are still doing
Of course, yeah. We still offer the COVID vaccines.
mental health, obviously available
Yes.
everywhere, and you also provide dental
Yes,
health.
yes.
Is there different parameters, different system for getting dental care at CFH?
Yes, yeah. So definitely my recommendation would be to call our dental office, and get those services. I know, the need for dental services in the community is very high. So we are still catching up after COVID. I mean, that still plays a big role in it. I know that need is really high. So just keep that in mind, but definitely connect with our dental department, and we can see what we can do for you.
And Nate, you were one of the first people to get the COVID vaccine in our community.
Yes.
Yes, I remember you had that shirt you were walking around town with.
Yep.
All right, so all health services, mental, dental, physical, it's all available at Center for Family Health.
Yep.
Yeah.
Well, you guys have a busy summer.
Yeah.
Yes, we do. Yeah.
Thanks for coming in and sharing all the information about your great services with us.
Yeah. Thank you.
It's always good.
Always great to see you guys.
Yeah, you too.
Christina Henderson, Clinic Supervisor, and Nate Nimps is Support Services Manager at the Center for Family Health. More to come on today's show.